Hello and good evening, I'm Melisa Idris.
And I'm Sharaad Kuttan.
You're watching Consider This, the show where we want you to consider and then reconsider what you know of the news of the day. Now, yesterday, the United Nations agencies UNFPA and Unicef released the initial findings of a survey on the impact of the MCO on low-income urban families who are living in city council housing projects or PPR flats. That's Program Perumahan Rakyat. Now, joining us on the show tonight to share a little bit more about the initial findings of the Families on the Edge survey, we have Stephen Barrett. He's the Chief of Social Policy at Unicef Malaysia. Welcome to the show, Stephen. It's good to have you here.
Thank you.
Now, it feels almost intuitive that the most vulnerable segments of society will suffer disproportionately during times of crises. So what did this study surprise you? Were there surprising findings within this study that were unexpected to you and the team?
So, first of all, you're right. It is a fact that in crises like this, low-income households are often most affected. And that was the first thing that we found. And the level of impact in terms of unemployment were quite stark. We found around 25% of household heads in these households had lost their jobs or had become unemployed. Or around 30% of households had their hours cut. We saw big impacts in terms of food security. Also challenges in accessing education for children in these households.
Right.
So that was expected to a certain extent, although some of those impacts were starker maybe than we might have expected. If you look at the aggregate picture in the country, of course some of those figures are significantly above what you see in the country more generally. I think then the next sort of more surprising thing, or again, some people wouldn't have found this surprising, is that female-headed households, single mothers mainly, they were even more greatly affected than the general sample size. So you saw all of those indicators that I was talking about there even worse in those households, and the children in those households were also more badly affected. But it wasn't all bad news, and I think that was, and I guess this is probably maybe the most surprising element of the study. These families demonstrated a lot of resilience, a lot of dignity, and a lot of ambition to get back to work and to recover after the crisis. And it did really strike us that these are households that are not waiting for handouts. They are looking to work their way out of their situation if they can, but they face very, very significant challenges. 39% of these households contain somebody with disabilities or a chronic illness, and that fundamentally affects the abilities of these households to work their way out of their current situation.
I mean, what's fascinating, of course, is that the MCO period, the lockdown period, puts the system under stress. So there are already existing systems for social safety nets and so on. And you spoke about the resilience of individuals and families, but there's also the question of systems resilience. And I think your report very interestingly points out to what some of the good news, as it were, is that in terms of prenatal and antenatal care, people continued to access that quite well and significantly. But there are, of course, all these failures, and some of them predate the MCO period. And how do you, in terms of your study, how do you make sense of that? Are you seeing the MCO lockdown as a kind of experiment, a social experiment at large, that allows you to see whether the system actually works? And therefore, when you think it through, is it the long period, the larger system, that's more important to focus on?
So I certainly wouldn't see it as an experiment. But you're quite right. What the COVID crisis has cast into very stark relief the challenges that pre-existed in many of the systems. And if we look at the social protection system in particular, many countries around the world had a fairly robust social protection system that they could start with. So many countries invested and doubled down on things like their family benefits. They obviously had unemployment insurance schemes and unemployment benefits, disability benefits, pension schemes. Many countries leveraged those as a measure of first resort. Malaysia didn't have many of those things to start off with. So what Malaysia had to do, and it did it very, very quickly, is implement things like the BPN, which our report showed was absolutely critical to mitigating the very worst of the impacts on these families. But it had to be built from, I wouldn't say from scratch, but it was something that had to be initiated and there's a real question over, how efficient that is, and whether, more sort of longer-term policies would be...
Something you said a bit earlier about the low-income female-headed households, they were particularly vulnerable during this period. Did you find that within the low-cost city council flats that there were more, female-headed households compared, and why were they particularly vulnerable specifically?
So the female-headed households in our sample were, I think, around 1 in 5, I think, which is, I think, somewhat over the national average. In terms of why they are particularly vulnerable, I mean, first of all, they had less access to social protection than male-headed households because of, and that's a common feature of all economies and all societies. Women tend to have low access to employment-related social protection for obvious reasons, constraints to female employment, and that's particularly elevated here in Malaysia. We know that female labour force participation is much lower in Malaysia than other countries, and other aspects. I mean, there's issues of social exclusion and access to information.
The survey found that 1 in 3 single mothers lost their jobs during the MCO period.
Yes.
That is a startling figure.
Yes. So many of those women were working in the informal sector, so they didn't have access to formal employment. And when you have an increasing informality in the economy and the workforce, then those households are going to be the ones that bear the brunt in situations like this.
You know, Melissa, you'd be very interested in the gender pay gap, and I think there's a stark statistic in your report that with the lowering of the average income for households, the difference between men and women was 1,800 to 1,000 in 2019, and then it goes down to 1,200. There's a 675 for women.
Yes.
That's just over half what a man earns. Now that should enrage you, and
it does.
I do want to know. So this study, and I know you're kind of halfway through it. Is this, really kind of designed to help policymakers think in more granular fashion about what's happening on the ground and how they might address it?
So the first thing the study is designed to do is to move beyond the aggregate. So at the moment, most of the discussion in the policy sphere focuses on the national level pictures, these aggregate trends, and our first message is we need to dig below the aggregate and look at how is it impacting on low-income households, and then looking at female-headed households in particular. That's point number one. Point number two is that the study is designed to follow these households over a number of months, over the recovery period, and that gives us an opportunity to explore some of these issues in more detail, the whys and the wherefores. This first report that we published is the immediate impact of the MCO period, and now what we're doing is we have the study contains 2 arms, a quantitative component and a qualitative component, and the qualitative component focuses mainly on female-headed households, and that will give us an opportunity to investigate with those households their experience of the crisis, why are households not accessing programmes, services, employment opportunities vis-à-vis others.
Okay, there's a lot to unpack in this report. It is a thick report, even though it's the initial findings, but we're going to take a quick break and come back and continue this conversation with Stephen in just a couple of minutes. Stay tuned to consider this. Hi, if you've just joined us, you're watching Consider This. I'm Melisa Idris. With me is Sharaad Kuttan. We're speaking to Stephen Barrett, Chief of Social Policy at Unicef Malaysia, about the Families on the Edge report. This is the first in a series of reports which aims to look at the immediate social economic impact of the COVID-19 crisis on a group of families with children in KL's low-cost flats or PPR flats. Now, Stephen, even before the pandemic, these low-income family in urban areas, they were already struggling to cope with the high cost of living. The health crisis put extraordinary stress on these households, and what we've seen is that the government has released, the Prihatin package, the Penjana package, all in the hopes of cushioning the financial impact of the MCO. Has that government assistance been effective in hitting the right spot when it comes to those who need it the most?
So what our study showed is that 90% of the households in our survey benefited from the BPN, and over 50% of them, I think 55% of them, said that that was the most useful support that government provided to them. Other forms of support that were provided, other policies, were less relevant to this socioeconomic group. For example, loan moratoriums, for example, they didn't feel that those were necessarily relevant to those groups. Maybe they weren't targeted for that group. So what we can see, I think, is that these households were protected for the most part during the most intense period of the crisis from catastrophe, many of them. That is not to say that they didn't suffer significant hardship. We saw rising food insecurity in these households. Up to 18% of households reported not being able to buy enough food. So that there was a significant impact, but the support that was provided was critical. I think there's still, now the question is, what comes next? Right. Because the COVID crisis is a long-term crisis. Although Malaysia's weathering it very well by global standards and has dealt with the crisis from an epidemiological perspective very well, there is a global economic downturn at play here, and that will feed into Malaysian employment, underemployment, and welfare in this group. So the question is, how do we support these households over the longer term and to avoid growing disparities?
I want to ask you, and since you mentioned food, you noted, and I think a lot of media picked this up because it's the easy, it's a kind of startling and easy to imagine thing, the eggs and noodles, right? Instant noodles kind of headline. But what lies behind it in terms of actually the nutritional content of the food? So if eggs were a substitute for other types of protein, okay, well and good, but then the question is, are kids suffering, say, a nutritional deficit that's going to affect them in developmental terms? And is anybody monitoring that?
I think it's a little bit too early to tell. Nutritional impacts are experienced over a long period of time. And the first point to make is that we already know these families were often food insecure. They were often struggling to provide good quality diets for their children. That situation would likely have to have deteriorated. And we see some emerging evidence of that in this study. We see changes in dietary patterns away from fruit and vegetables towards and meat towards cheaper forms of protein, egg, and noodles. If that pattern was to continue, then we would see nutritional patterns.
Is anybody monitoring it? This is my question. So from government?
Yeah, of course. I mean, the Institute of Public Health monitors nutritional status in the population, and of course the 2019 NHMS was published only recently, which showed a further deterioration in child stunting rates. Right. So if we look around the world, when economic crises happen, unless they are adequately mitigated, then you will see rising food insecurity, you will see rising malnutrition amongst children, which is why the Secretary General of the UN said there's a risk that the COVID crisis becomes a child rights crisis, and very much for impacts like that. Okay.
Well, you said a little bit, I want to touch a little bit about the financial assistance. So 90% of the households that you surveyed are receiving BPN. I'm wondering whether that was enough for them to kind of weather the hardships, not just from preventing catastrophe, but for a longer term. And you also said that, they wanted, the resilience is there. They wanted to have, to be gainfully employed, to be productive. Talk to me a little bit about what other financial assistance they received and whether that's going to be enough or sustainable.
So some of these households were eligible for the EIS, the Employment Insurance Scheme. Okay. Many of the households received support from civil society organisations. Local authorities, I think, also stepped up. But the BPM was the linchpin of the government response, I think, for these communities. And enough is there's never enough in a situation like this. It seems to me, as I said, that the worst of the crisis was mitigated for the majority of these households. But as I said, we did see an increase in reported food insecurity, and as I said, there's a question of now that the BPN is now expired. but the unemployment situation is still elevated, underemployment will still be elevated, and we need to be thinking not so much about, can we just get back to where we were, but we need to be building back better. We need to take the opportunity that COVID creates to reimagine what the support is being provided for families like these, and build a social protection system which is fit for the 21st century, that can create a more equitable society, and social mobility for the children in these families.
You said earlier, and this is actually something that maybe a lot of Malaysians don't know, is that we didn't have a robust social safety net before the crisis, and you said we built it quickly, or we built it up and tried to augment what was there. What do you think, and I know you've only been here in a year and a half, and I know you work for the UN, so you're going to be very diplomatic, but what do you think prevents us from creating a more robust social safety net? Is there something in the way we think about why people become vulnerable, why we've had such family situations that prevents us from being much more sympathetic or being focused on how we might find permanent solutions to this problem?
That's a very complex question. So Malaysia is not unique. It has, in its social protection system design, it has what you might call a dualistic social protection system. You have social protection for formal sector, higher earning formal sector workers, and then you have what you might call poor relief at the bottom end of the spectrum. The JKM programs for the sort of poorest 1.5% of the population, and there's not much in the middle.
Right.
And this is not unique. And as to whether that reflects sort of attitudes, I think all societies have issues around stigmatisation of the poor, misunderstandings of the root causes of poverty and what it takes to get people out of poverty, and societies navigate that over time. I think there is demand in Malaysia now and recognition that this missing middle does need support, and I think there's a recognition globally that poverty is not a static thing. People don't. There's the idea of the poor. It's very difficult to work out who is poor at any one point in time. Right. People's incomes change dramatically over even short periods of time, as in response to changes in life cycle, sorts of risks and vulnerabilities that affect households. So, when you realise that, when you understand that it's very difficult to work out who is poor, it's very difficult to track people's income even over short periods of time accurately, then you start asking options like more inclusive approaches to social protection and social security become more obvious choices for people. And I think that there is a need for all societies to go beyond thinking about the so-called deserving poor, the destitute, and think about providing a level of economic security for the population as a whole, as a basis for social mobility.
Well, perhaps this is, a chance for us to begin those difficult conversations and take them further. We're going to take another quick break. Stay tuned to consider this. Thanks so much for staying with Sharaad and I on Consider This. Let's continue our conversation with Stephen Barrett, Chief of Social Policy at Unicef Malaysia. We're talking about the Families on the Edge report. So this, as I understand it, is the first initial finding. This is part of a 6-month survey. What is it that this survey is looking for to kind of focus on for the next one? So the findings from this survey, what are you going to be focusing on for the next one in terms of how these households recover, specifically the challenges and addressing the challenges that you found in this report?
So, of course, with the end of the MCOs, children have gone back to school, hopefully. So we want to explore how families have managed with that return to school process, how children managed with that return to school in terms of their psychosocial response to the leaving the MCO and going back into the classroom. We want to look at how, whether as the economy does pick up, whether these families, low-income families, are picking up jobs again and picking up employment. Other areas, nutrition. You know, are we seeing long-lasting changes in dietary patterns, or is it a blip that will somewhat be corrected? So these are the sorts of things that we want to look over the next few months. You know, as those COVID policy responses, such as the BPN, ended, you know, how are families managing? You know, now that they have ended.
Stephen, were these households a data blind spot? I mean, the living conditions, the lived realities of these households, were they a data blind spot for policymakers in Malaysia?
So I think everyone's been aware of the challenges of the communities living in the PPR flats for some time, but I think, you know, being aware of it and having hard evidence of those facts is a different thing. And, you know, at the moment in Malaysia as elsewhere, we have big aggregate pictures on, you know, GDP figures and unemployment figures, but there's not very many cases where you can get high quality evidence of the impacts and experiences of a particular subset of the population, i.e. low-income families, and particularly women and children in those families. So I wouldn't go as far as saying it's a data blind spot. I would say that we are contributing to an ongoing debate and dialogue on policy responses to COVID, you know, for different sections of the population. I think the point is that, you know, the Malaysian population, like any other population, is heterogeneous. You know, you've got different people with different experiences, and you've got to understand those different experiences in order to craft relevant policy responses. You
mentioned several times that the BPN has ended as a policy. Yes. Should it have ended as soon as it did?
I think, you know, all governments had to put in place temporary measures, extreme measures. You know, the refrain was do everything necessary and do what it takes to protect people, and that was what was done. I think the government, you know, with the revision of the new national poverty line, I think there's active considerations going on, you know, in order to think about what's the sort of a soft landing might be provided for low-income families in the context of a new poverty line. I think it is urgent that policies are put in place that provide a bridge between what the support the BPN provided, and where we need to go.
What kind of policies would you like to see?
So, the UN has made a proposal during the budget consultation process for a very simple proposal to implement a child benefit, a disability benefit, and an old age allowance for all eligible individuals in the B40. That proposal, when you combine those three elements together, would reach, I estimate, around 70% of households in the BPN would be providing with meaningful income support targeted at households with these demonstrable vulnerabilities, disability, old age, children that need care and food. And
what's missing is unemployment benefit.
Yes, it is.
Why isn't that in the mix in the suggestion?
It is. In fact, that's something that the UN is already working on, or planning to work on with the EIS, on extending unemployment insurance to the informal sector and to those in non-standard employment, which is a gap in the existing EIS framework. So it's absolutely necessary. It's quite hard to do. I think our proposal was there's something that can be done quite quickly. It's fairly uncontentious. Older people with disabilities and children really do need support. We need to protect their welfare in the COVID context. And this can be done. We have the data on these households. We have information on children, people with disabilities can be made available, and these people can be targeted. So it's a ready available, off-the-shelf policy solution. And while we think about maybe longer-term options, and there are longer-term options, and you know, one option would be to extend some of those things to a broader set of the population. Many countries have in place universal or near-universal basic social pensions, basic child allowances. And there are other options like child and family tax credits that can boost people's earnings when they're in employment, low-income people. Look, those are more complex solutions. They take time to design, and they also will struggle to reach households in the informal sector.
Right. You said build back better. How radical should we be looking in terms of conversations? There are many conversations out there in the world. What should we plug ourselves into?
I think we need to be radical. I mean, if we look, just for example, let's take malnutrition in Malaysia. You know, that's going in the wrong direction. Inequality is going in the wrong direction. and the COVID will exacerbate all of these issues. So I think in order to get even back to the old trajectory of change, which was going in the wrong direction, we need to be quite radical, and to reverse the trajectory and deliver on the ambitions of the Shared Prosperity Vision 2030, that does require a radical agenda. And the sorts of policies I just mentioned there could deliver on that. There are, if we look at the higher income countries and the OECD in particular, you do see a direct link between investment in benefits for families and child relative poverty rates. There's a very strong association. And when you have lower rates of child poverty, there are a whole range of long-term benefits for a society for that. Right. I think you also need to be thinking about things like preschool. If we want to, say, protect people's well-being and in the crisis, we also need to build more productive, Malaysians. And that means starting early, getting children into preschool. And we already know from another study that Unicef has done that low-income families and low-income children are less likely to be in preschool. So we have to address that as well.
Stephen, thank you so much for joining us on the show. It's been such a eye-opening, lots of information.
Yeah, clearly we should have another hour or so to
delve into this report. Thank you so much for your time and your insights. That's all the time we have on this episode of Consider This. I'm Melisa Idris.
And I'm Sharaad Kuttan, signing off for the evening.
Thank you so much for watching, folks. Good night.
Thank you.